Hey, Dr. Mike here. Get ready to learn about the health benefits of vitamin K2 with our special guest.
You're listening to Live Foreverish, a show dedicated to helping you live just a little longer. Here's your hosts, Dr. Mike and Dr. Crystal Gossard.
All right, welcome to Live Foreverish. So, Dr. Crystal, I love it when we talk about the basics.
Always, especially when it's a basic that's so powerful. And has benefits beyond the expectation.
Exactly. I love that. And when we say that, there's good research to support it. So we have a special guest today. We have an expert in vitamin K2.
Yes.
Right? We have Dr. Maresz. She is the former president of the International Science and Health Foundation and former scientific coordinator of the educational portal vitamink2.org. She currently is the executive coordinator of the Vitamin K2 Scientific Advisory Committee. Dr. Maresz, welcome to the show.
Hello. Thank you for having me here. Great pleasure on my side.
As we dive into all this, everything vitamin K2. Well, we don't have time to talk about everything, but hopefully we'll get to a lot of stuff. Let's just talk about, just to make sure the audience knows what we're talking about. Can you just lay out vitamin K for us and how it breaks down to the two basic forms and what's the major function of each form?
Yes. So vitamin K in general is known by vitamin K by many people, and many doctors and nutritionists, they understand only vitamin K. But right now we know that vitamin K1 and vitamin K2 can have a bit different function and different benefits for the body. So vitamin K was discovered almost 100 years ago in 1929, and it was discovered because of the function important around the coagulation. And even the name vitamin K is kind of coagulation vitamin. But 100 years later, we know that vitamin K is not only coagulation vitamin. And it's very confusing also for some people because under umbrella of vitamin K, we've got vitamin K1 and multiple forms of vitamin K2. Right. And vitamin K1 is mainly presented in veggies. For example, spinach, broccoli, we can find vitamin K1, and many doctors, when they recommend vitamin K and they talk about vitamin K, and you can see even a lot of pictures when they talk about the benefits of vitamin K, they will put only the green veggies. But it's only half of the story because we've got the second group of the vitamin K2, menaquinones. And under this term, we've got a multiple different menaquinones, which different in the length of the side chain. And I'm not planning to go into chemical structure differences.
Yeah, we don't need to do that.
No, let's keep it simple. But it's important to understand that under this term, we can have two, I would like to mention maybe two menaquinones. Okay. Because two of them are present in a supplement form on the market. So it's worth to mention MK4, menaquinone 4, which is, for example, can be found in eggs. It's one example, or meat, so like an animal-based product, and a longer chain menaquinone, MK7. So MK7 has a longer chain than MK4, and it can be found in a fermented products, so like a cheese. And the richest source of vitamin K2 as MK7 is Natto, fermented soybean. I don't know if you had opportunities to try it.
I have, yes. It's not my favorite thing.
Oh, no, not for... How about you, Dr. Crystal?
I'll be trying it tomorrow. We have another show called Real Wellness, and we are doing a demo of fermented foods. And Natto will be one of our fermented foods. Wow. And so I'll have a chance to try it. And I don't know if I'm excited about that, but I do know that it's a source of, the MK7 form of vitamin K. So we'll see.
So I'll be happy to learn if you like it. So I had the opportunity to try it. And I'm Polish, and we've got a lot of fermented food in our kitchen, like in our tradition. but I'm not in favor on Natto. It's impossible for me to implement Natto as a rich source of MK7 in my daily diet. So I stick with a supplementation because I know that it's really, really important to improve your vitamin K intake.
For sure.
And
Well, I think that. Oh,
yes.
I'm sorry.
Yeah,
Go ahead.
with your question. Go with your question, please.
No, well, I think that brings us to the next question that we wanted to hear from you about populations that maybe have low intake of vitamin K, but in particular, I don't think vitamin K1 is an issue or a concern since we see it in the green veggies, but probably K2. And so who are these populations that would be not receiving enough of the K2? And then I would imagine that most would not be receiving the MK7 form. But can you just describe both forms in general when we look at K2?
This is a very, very important question. And many, many nutritionists and doctors, they don't understand this twist. Because very often when we talk about deficiency, we would like to see the issue that we are deficient. So, and because we don't have a specific recommendation for K1 and K2, and both of them are under the same umbrella, the doctors very often look at vitamin K status as a whole and mainly they focus mainly on coagulation. But coagulation is only a part of the story, and it's very important to bring the triage theory here because vitamin K applies very well to triage theory. So how our body uses vitamins? Vitamins are used mainly just to support the basic, very important functions, and they will use vitamin K2 for survival first. And what is the survival component of vitamin K? Of course, coagulation. So if we provide our body vitamin K, K1 and K2, first the liver will say, I needed vitamin K to support coagulation because you want to be alive. Okay, if your bones don't receive enough vitamin K, K1 or K2, it's less problematic theoretically because you don't die. Okay, it's a not life-threatening problem, but in the long run, your bones will get weaker and weaker. So from a triage perspective, it's really important to understand why we don't talk about vitamin K deficiency. Because the majority of doctors, they will go and ask the patients, okay, bring me your blood test. They will look at the clotting panel, and if your clotting panel is fine, they say, okay, you've got enough vitamin K.
Right. Yeah.
And this is true only for the liver. But what about the other tissues? And here we've got vitamin K, because vitamin K1 and K2, I said, they are in different products, but they also have a different chemical structure a bit. They've got a different saturation of the chain. That's why they've got different lipophilicity. They are transported in the body a bit differently. And vitamin K1 is transported pull out by liver. Okay, let's secure clotting first so you can survive. And your coagulation, vitamin K dependent proteins are ready. When you cut your finger, you don't die because of the bleeding. But in case of vitamin K2, it's transported differently. It stays in the blood circulation longer, and it's easier for vitamin K2, MK7 mainly, to reach extrahepatic tissues. So vitamin K2 is a wonderful nutrient, very, very important for your bone and cardiovascular health and more.
Yeah. So clinicians today, just to kind of summarize all that, make sure I'm saying this right and thinking about it right. Clinicians today are really just looking at coagulation factors. If all that looks great, they're like, okay, your vitamin K is fine. And that may be true for the liver, for K1, but that doesn't necessarily mean that you have enough of the vitamin K2s like MK7 in other parts of your body, which is just as important, especially in the long run, like your bones. Does that sound right?
Yes, it's perfect. And is it important for Americans? because we are talking here, for life, for your podcast. So is it important in United States? And maybe you've got enough vitamin K. But if you look and go to the Linus Pauling Institute Micronutrient Center, you will find out that almost 70% of Americans fall below the adequate intake of vitamin K.
Yeah.
Wow.
So this is already scary. And we are not talking about vitamin K2. We are talking vitamin K, which is only the guidelines which reflects coagulation.
Right.
So
Yeah,
think
yeah.
about your needs for extrahepatic tissues.
Yeah.
It's even worse.
I also think about the trending vegan vegetarian movement, specifically the vegan movement.
Yeah.
And if we're understanding that K2 is coming primarily from animal product, eggs, meat,
cheese, stuff like
that, then they aren't receiving even K2.
Yeah. That is a concern.
So that's interesting.
Coagulation may be great because they're getting their leafies.
But still,
right? But everything else may not be.
Yeah. On one side, yes. On another, no. Because if we talk about the green leaves and K1, we talk how much K1 is in spinach. Okay. And we can say, okay, spinach is a very rich source of vitamin K1. But we need to think also about bioaccessibility. How much vitamin K1 from spinach can reach circulation? And it's only 10% from spinach. So it's not so much. So so if we look at who is the most at risk of vitamin K suboptimal intake, based on a research from Maastricht and published more than 10 years ago, and we know that children, because of the fast bone growth, and adults over 40 years old, they are in a high need of vitamin K supplementation. Because these populations, they've got the highest level of inactive vitamin K dependent proteins, important for bone and cardiovascular health. And we are talking about the healthy population. So we are talking about kids and adults over 40 years of age. But we have to remember that we've got a lot of people who deal with diseases, with kidney problems. Like the kidney patients, it's known that they've got a huge needs for improvement of vitamin K status.
Yeah, and spinach is not going to do it, right? Spinach alone isn't going to do that. So you're talking. Listen, Dr. Chris and I, Dr. Maresz, we love what you're saying. Food first, no doubt. But we say this all the time. When it comes to these key nutrients, it may not be enough to get that optimal level for optimal health, right?
Yes.
So that's where supplementation comes in. I want to move into the conversation into specifically the K2 side and MK7. And I want to ask you, what are the clinical benefits that have been proven from vitamin K2 supplementation?
So, first of all, the first benefit is the improvement of extrahepatic K status. We don't talk about it. We don't mention so much about it. But I'm happy to share today that vitamin K2 as MENA-Q7 was tested and evaluated in more than 20 clinical trials. And the first study was published in 2007. And they show the benefits to support bone tissue and to support bone mineral density, bone strength, and also arterial system, cardiovascular health. So vitamin K2 as MK7 was able to improve elasticity of arteries in 3-year clinical study with 180 micrograms. It also was able to improve elasticity in arterial system in kidney transplant patients. And right now, we also know that vitamin K2 as MK7 is able to improve even blood parameters in women with a high stiffness index at the beginning. So we can see a lot of clinical benefits around the bone health, at least in kids also, in kids and adults, and around the cardiovascular health.
Well, but doesn't I know definitely in the chronic kidney disease, MK7. A lot of good research there, but isn't the research on the arterial side, especially calcification stuff like that, a little not quite as strong as, say, for kidney health?
Yes. So I can say that you know about a lot about it. So we see a lot of papers which are very optimistic and they discuss the importance of vitamin K2. And I'm familiar with the group from Cleveland Clinic. They published in 2022 review paper vitamin K2 as a neglected player in vitamin K2 in cardiovascular health. But we have also a negative reviews which say, okay, bring evidence, first before the enthusiasm about vitamin K2. And I can say why not all clinical studies show the benefits of vitamin K2. And the lack of benefits are mainly in kidney population. And as I said before, the kidney patients, they've got a huge needs for vitamin K. So if you look at the status of the population, if you look at DPU-CMGP, which is like a marker of vitamin K status, extrahepatic K status, the numbers are really, really high, which represents very low extrahepatic K status. But if you look at the dosages which were used in the kidney population, the dosages are the same like in healthy population. So the first clinical study with MENA-Q7 started with 90 micrograms of MK7 in kidney population. And right now, the current GNOSIS study, ongoing study, is with 1,000 microgram MK7. So it's kind of answer why so many studies didn't show the benefits.
Dose.
Because the dosage for so many for a kidney patients was very, very low.
Right.
And we don't know what is the optimal dosage for kidney population. We know what is the beneficial dosage for a healthy population right now, based on MENA-Quinone 7 data.
And I guess you're figuring or thinking that as we learn more about what is that appropriate dose, not just for kidney patients, maybe for arterial calcification, we'll start seeing the results we would expect.
Yes.
Okay.
And what is that dose for the healthy population?
Yes. So if we are talking about adults, so we base on data from Maastricht University in healthy population, the beneficial dosage which was able to improve extrahepatic K status, so we can expect the benefits for bone and tissue later on, was 90 micrograms daily. But 3-year clinical study was using 180 micrograms daily. And 1-year clinical study was also using 100 micrograms daily. So everything depends on your diet and on your intake, because if you take care of your diet, you've got some eggs, you've got some cheese, you already bring some small amounts of vitamin K2 to your diet, you should be maybe okay with 90 micrograms. But if you are older, and this is again the trick, because like everyone would like to have what is the optimal dosage. The optimal dosage for me is not the same as for you probably. For example, Dr. Mike is a man, probably heavier. I'm 100% that your weight is, you will need more. And even the recommendation around vitamin K in US are different for men and women. And in many clinical trials, they use a one dosage. So we've got still a lot of room for improvement here. But on my side, I will recommend at least 90 micrograms up to 180 micrograms daily. And you mentioned, Dr. Mike, the calcification, okay? Because I said, okay, we've got a great benefits around the improvement of elastic properties after MK7, but what about calcification? Because this whole story, like marketing story based on the research data, is that vitamin K2 directs calcium. That calcium cannot stay in arteries. So And we've got currently one study. You need to stay and look at the Gnosis website because they will talk more in 2026. The data are already analyzed. Professor Schurgers, who is a chairman of Gnosis Scientific Advisory Committee, already presented the data at Linus Pauling Institute. He showed that vitamin K2 as MK7 in dosage 360 micrograms was able to slow down the progression of calcification. So this is a brand new data. I'm really excited about it. I think it will bring a lot of optimism and a lot of interest in this nutrient.
I think that's fantastic. I can't wait for it because that's a higher dose and it's good for us to get that information. I'm curious about the current landscape on vitamin K testing. Do you have any thoughts on that? Can you just share, like, if you were to have a vitamin K test performed, what are they testing? Are they testing all forms? And do you see any research in the future that can help to improve understanding vitamin K levels through that assessment?
This is a very important topic because if we talk about vitamin K1, it's easy for the doctor to ask, okay, bring me the test of vitamin K1 in the blood, give me the prothrombin time and other clotting panels. But what about vitamin K2? So there are multiple ways to evaluate vitamin K2 in the blood. For example, HPLC method can look at MK4, MK7, but this is very specific and costly method, and it will show you the exact amount in your blood at the moment. So if you have, for example, Natto in the morning and you take a test, you will have a nice MK7 level. I know based on a Maastricht research that the majority of Western population, they've got a 0. MK7 level is like 0 or close to 0 because we don't have MK7 intake. But there are better tests to use to evaluate vitamin K status. I prefer honestly more to look at vitamin K status. So how your extrahepatic tissues are supported by vitamin K dependent proteins. Are those proteins activated enough to bring calcium or to protect calcium, from arteries? And we can use here two assays. We can use DPUC-MGP, which is the phosphorylated uncarboxylated MGP, which is the strongest inhibitor of soft tissue calcification. Or we can use UCR, which is the ratio between activated and inactivated osteocalcin. Unfortunately, both tests are used only in a research. So if you go and read the clinical data, you can see, okay, DPUC-MGP was decreased, extrahepatic K status was improved. But if you want to go to the doctor and say, I would like to know what is my extrahepatic K status, do I support my bones enough? It's a problematic. We don't have it. Maybe one day the diagnostic teams, will figure out. We know that there are some attempts into this direction, but the research takes time, and so we don't have a good diagnostic tool. We've got the really good research tools to evaluate vitamin K2 or vitamin K2 status.
Yeah. When you ask somebody or tell somebody they should probably supplement with vitamin K in general, whether it's K1, K2, what have you, right off the bat, people want to know, well, that's going to make me clot, right? Like that's going to increase my clot risk or something. Tell us a little bit more about the safety aspect of vitamin K supplementation.
I love this question. I love this question because I'm a huge fan of vitamin K2. And I'm a huge fan, and I recommend everyone, I ask my mom, just, ask your doctor, that you would like to have K2. And the doctor told her, oh my God, you are 70, you will increase your thrombosis risk. And it's completely not true. And because vitamin K K in general has an excellent safety profile. And we are talking about K1, MK4, and MK7. So if we are planning to talk about MK7 only today, so I can say the same. So MK7 has an excellent safety profile. And vitamin K2 as MK7 was used in multiple clinical trials in kids and adults, in healthy and sick population. It was used in a combination with different drugs even, and people are still afraid. So I can say that based on a clinical trials, we know that the safety of vitamin K2 is very, very, very good. And even when we talk about the safety, I can say that NIH and European Food Safety Authority didn't set up the upper limit for vitamin K, which means that the safety profile is okay. We've got an upper limit for vitamin D because of the toxic issues around the high dosage, but not for vitamin K. But there is one contradiction. And the only contradiction we have about vitamin K, K1 or MK7, is about anticoagulants, which are vitamin K antagonists, like warfarin. And it's the only very, very tiny group of anticoagulants. And still, people think, okay, you cannot combine vitamin K2 with anticoagulants, which is not true. Only one specific tiny group. And in US right now, new oral anticoagulants are like 70% probably, or maybe 60. It's very popular. We've got different drugs which can influence hemostasis, like aspirin, for example, heparin, and all of them can be safely combined with vitamin K2 as MK7. MenAQ7 even had one study when they combined rivaroxaban with MK7 for 1 year in hemodialysis patients, and it was shown safe. Regarding safety, it's excellent profile.
You're listening to Dr. Kate Maresz. She is the executive coordinator of the Vitamin K2 Scientific Advisory Committee. Dr. Maresz, in summary, what would you like? Is there any last thing you would like our listening audience to know about vitamin K2 and the work that you're doing?
So I'm a huge fan of this nutrient. I think that the vitamin K2 is very important nutrient that everyone should know more about it. I'm also not afraid to use it in my daily practice. I also recommend everyone who has a teenager like me, an active teenager. It's very important and missing nutrient in our diet. I also happy, to coordinate this vitamin K2 scientific advisory committee in Gnosis by Lesafra, because we are able to bring independent expert group from different geographical regions with a different background to talk about vitamin K2, what is missing, to educate people, to bring more knowledge, to also give the advice to Gnosis by Lesafra, but also to interact with other independent experts in groups. So I would love to share the knowledge with everyone. I would love to convince everyone that we really need vitamin K2. I hope I convince you both.
You're doing a great job.
She convinced me.
Yeah, you're doing a great job. Is there a website that you would like us to share?
You can always reach me through my ResearchGate or LinkedIn or through Gnosis. So if you have any questions, I'll be happy to answer. I'm also happy to collaborate with other people. Gnosis is also involved with other companies in a task force project to bring more knowledge about vitamin K2 and more experts, because it's not like the one company and the knowledge is, for a tiny group of people. No, we would like to bring benefits to more people. And I'm really proud that to support Gnosis, because they've got an excellent product in portfolio.
Fantastic. Thank you so much for coming on today. We really appreciate it. Very insightful. I know our audience will like this a lot. And don't forget, you can go to liveforeverish.com where you can download, like, share, comment, subscribe, and review all kinds of episodes. I know there is something in that library that you will find of interest to you. That's liveforeverish.com. And then our sponsor wants to say thank you. Go to lifeextension.com and put in the discount code podcast, and you will get 10% off $50 or more plus free shipping. That's at lifeextension.com. I'm Dr. Mike. That's
Dr. Crystal.
Thanks for listening.